we have to be realistic as to what their whys of SM are, because that's going to impact their capacity.
Some teens might want to work on goals by themselves, but a parent should still have that conversation potentially about what that might look like for them.
Say 3 positive things to them in a day. Watch how they start to open up to you and not feel so judged.
We've been talking a lot about structure and predictability and like calendars and things like that. So if you have, like, let's say a bedtime routine, like you were saying, giving the choice, let's say it's 8:45 to 9 o'clock is like the last activity you're doing before bed. Maybe there's a list of like choices. Like we could either finish your puzzle, you can either play on your tablet.
Welcome back to another episode of the Unspoken Words podcast, hosted by Dr. Elisa Shepon-Blum and the Smart Center. I'm Brandon, Unspoken Words podcast producer, coming to you from Aspen, Colorado as I wrap up the last couple of days of my honeymoon. I did not bring my microphone, so apologies for this audio not being the best. This episode features a detailed discussion between Dr. E and Dr. Jenna Blum on authoritative parenting. It's sort of a continuation of episode 33 when they discuss the 4 different parenting styles. So if you haven't listened to that episode, I would suggest going back and starting there. In this episode, Dr. E and Dr. Jenna discuss the importance of authoritative parenting, why authoritative parenting is the most ideal type of parenting style, especially during treatment, ways to become an authoritative parent, and more. Before we get started, remember that if you have any questions on anything you hear in today's episode, please head to selectivemutismcenter.org/ask Dr. E, that's ask-dr-e, and enter your question. We read all of your submissions, and we do our best to answer them on podcast episodes, blog posts, and on social media. Speaking of social media, are you guys following the podcast on YouTube and Instagram? We post the best of every episode on both of those platforms. You can find us on Instagram at unspokenwords_podcast and on YouTube at Unspoken Words Podcast by Dr. E. All right, without further ado, please enjoy the latest episode of the Unspoken Words Podcast.
Hey listeners, before we get started, I want to tell you about Communicamp, our 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. It's over 16 hours of parent education and support, as well as 16+ hours of treatment for your child or teen. Spaces are limited and spots book fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice. Okay, now enjoy the episode. Hello, everyone. Welcome to Unspoken Words. I'm live with Dr. Jenna Blum. Hello.
Hi.
How are you?
I'm good. How are you?
Good. Anything new?
Not much.
Not much since we last had our podcast. I think we just got back from a big wedding, right? Of one of your siblings and my son, right?
Yeah.
And we're a little exhausted, but we're going to get through this. Anyway, we're excited to talk about parenting since it's such a critical component to treatment in general, but just how to raise a child. We did a recent episode called the 4 different parenting styles, which is episode 33, where we talked about the different parenting styles, the effect and impact on treatment, and different descriptions of all of them. So which were the ones we talked about? We talked about
authoritative parenting, which is going to be the main type of parenting we're going to talk about today. Authoritarian, permissive parenting, and then also uninvolved. So those are the 4 parenting styles.
Right. So the most ideal is obviously authoritative. And one thing I want to say is that every family has a little bit of every type of parenting, right? Mm-hmm. So we're not robots. We didn't even come with manuals on how to parent, but research shows that authoritative parenting, and we're going to go over what that is. And then we're going to talk about how to develop and build up authoritative parenting. Mm-hmm. And what I have found over the course of my career, and there is no research on this, specifically in what I'm talking about in terms of the exact effect on treatment, that having authoritative parenting is the most ideal and the quickest way to have positive treatment effect. Mm-hmm. And that is a result of the child feeling safe, in control, not judged, supported. And so treatment is a much smoother path. And to be clear, what I mean by treatment is helping the child or the teen reach their capacity. So we have to be realistic as to what their Ys of SM are, because that's going to impact their capacity. So an individual that has speech and language challenges that are innate, or some learning challenges that are innate, or they're on the spectrum, et cetera, we can help them reach their capacity. So many can completely overcome their selective mutism. So again, the most ideal parenting is authoritative. Thought maybe you could start out with describing authoritative parenting to our wonderful audience listening today.
Yeah. Well, I think the last time we talked about it, I kind of explained that there was like these two type of ingredients to parenting. And I feel like that's the best way to think about it. So the two types of ingredients is the level of warmth that you provide to a child, like, you know, the amount of comfort, the love, the affection that you provide your child, a lot of that emotional support, and then also the level of control. So the amount of structure, the predictability, the consistency that you're giving your child. And so with those two ingredients, authoritative parents are the two types of types of parent that have both of those ingredients equally. Sometimes what ends up happening is they're a little uneven. So again, like the permissive parent might have a lot of warmth, but maybe they lack a little bit of that control. The authoritarian parent has a lot of the control, but lacks a little bit of the warmth. And then uninvolved has a lower level of both. So authoritative parents are just found to have a higher level of both of those.
I just love how you describe that. And we talked about it in the last podcast, which is great that we're reviewing this for those that haven't listened to episode 33. And we do encourage you to listen to that. But that it's kind of like a seesaw, right?
Yeah.
Yeah.
Yeah, I think I said that last time too. Like I always like to say, we always want to keep everything leveled, right? And I think sometimes, especially for kids and teens, and even adults too, but if something's not even, right? Like if you're sitting on a seesaw and something just feels like let's say you're getting too much of that control, but not enough warmth, you know, you feel a little bit out of control. So our job, especially working with the SM population, is we want to just pass them more. You always say like transfer the control over to your child. So.
That is such a key aspect to social communication anxiety treatment, a CBT-based program that I developed. And when the researchers kind of analyzed SCAT, what was an overwhelming theme is transferring control to the child where they feel out of control. And when I think about the different types of parenting, authoritative is, like you said, the most balanced, which we're going to go into, but authoritarian, where it's like my way or the highway parenting, the child feels very out of control because they're being told everything and they have no control. And that's very frustrating. And then the permissive parent that's letting them kind of do what they want, when they want, how they want, like, you know, do whatever you want. They still feel out of control because there's no guidelines, there's no structure, consistency, routine, predictability, and that causes them stress and anxiety and again affects treatment path, right? And then the uninvolved parent, they're like lost, these kids. They don't know where to go, when to go, how to go. Again, causes that imbalance and lack of control. So the lack of control that these children feel in different parenting styles, and therefore the control they feel, in my opinion, is probably one of the overwhelming themes to progression in a positive way with treatment.
Yeah. It's kind of like you talking about control made me actually think about the idea of like having like a remote control, like if you're watching TV. And so I almost think about like someone who is an authoritarian parent, you know, they might not allow their child to even have access to the control. So they're the ones that are just like, you know, controlling the entire TV, but their child, you know, doesn't feel any connection to their parent, or, you know, they don't even discuss what they're necessarily watching. The permissive parent maybe like throws the child the controller, but they don't have a manual to understand like how to use it. So they're sitting there with actually too much control because they need their parent to help guide them. Again, the uninvolved, maybe the remote control is not even like in the room. And then the authoritative, they're sitting there together kind of deciding as a family about like what they want to watch, or the parents kind of guiding them of how to utilize that. So it's kind of like an interesting
Did
way
you just
of
make that up? Or?
I just made that up, actually.
You're a genius.
Thanks. I got it from you, I think.
Maybe.
Maybe. You are my mom.
That's true.
But I did just make that up.
That's right. That's
Thanks.
amazing. That's what happens when like you raise somebody and they're with you all the time and they just hear your thoughts. That was good. I love that.
Thanks. Honestly, we didn't even prep for this podcast. This just came right out.
Yeah, I know. I love it.
Thanks.
So I thought of course. So I thought what we could do and I'm honored to have you here, to be honest. This is, I say this a lot, but you have worked so hard in your training and that emphasis on family dynamics and just families in general. So, your background and training is just so wonderful for our population. And I just love it. So you've been engrossed in this, ingrained in this for your life. But just the fact that you just specialized in that aspect in your training is just such a value to our family. So I thank you.
Yeah,
and I'm just grateful to have you here. And I love that we share a wall between our two offices, but that's a whole other thing.
Thank you.
So I think, what I'd like to do is just discuss how with authoritative parenting, the goal is to help a teen feel safe, in control, very confident, and respectful to others. And we need to look, listen, and learn from our children. I always call it the 3 L's: look, listen, and learn. Because our children, our teens will tell us what they're feeling, what they're feeling in general, and how they're navigating. And we need to understand and respect that rather than try to control it or get frustrated by it, because that's the answer. And so training parents to look, listen, and learn is really important. And the question, what does my child need? Not what am I doing for my child, but what do they need? And how do I support them in the best way where they feel safe? And it increases their confidence and it increases and lowers their anxiety, honestly, because when a child feels in control, when they feel that confidence from you and they're having a positive experience, their anxiety goes down. So we know that SM is a social communication anxiety, but the more out of control a child or teen feels, the more anxious they feel. So this will inevitably lower anxiety by altering our parenting style, which again, for us, and I say this all the time, is, when Communicamp was being developed, the intensive group treatment, of course we do this in our individual programs at the Smart Center, but our group program, Communicamp, for me, when we were starting this, the first thing I said is all day parent education, that yes, our children are important. And of course, they need to experience the positiveness of their progression of communication and work on skills, and our clinicians work with them on skills. But such a big part of our program, which is what we pride ourselves on, is our all-day parent education and support, 15, 16 hours of it. Why? Because kids can't overcome this without the help of their parents, plain and simple. So you can't drop your child off in the therapist's office and stay there for 45 minutes to an hour, leave, come back the next week, and the same thing happens, and you are going to expect your child to make this huge progress, because your child isn't going to go around going, hey, Mom, let me do this goal. This is how you do it, Mom. Or, Mom, please talk to me in this way, because this is going to make me feel safe and in control. And these charts are going to help me know what, when, and where. Kids aren't going to do that. The older they get, of course, the more involved the active part they play in treatment, but the parents have to be the facilitators. And we see this across the board in research, is that parent implementation and facilitation and teacher implementation and facilitation is the key to consistent progress. Yeah. So I know I just kind of went off a lot on some of this, but I want our audience to understand that if you are expecting your child to overcome this without your help, you're going to be pretty upset, because it's not going to happen. Not to the level that we know, and as quick as it can be with your involvement in a positive way. So hoping our listeners who are working with different clinicians are really working with them on their parenting, how to adapt it, how to troubleshoot, what's going well, what's not going well. How can we parent your child in this moment and support them?
Yeah. And you mentioned that when parents are facilitating and doing all these things, it lowers a child's anxiety. But when we think about parenting, lowering your child's anxiety also lowers your own anxiety as a parent. So I think there's almost that, effect of, you're obviously trying to help your child, but I know that a lot of times parents feel that helplessness of, I don't know how to navigate. What if I, what if I make this move and then it goes a little bit, off track or something like that. But the more that we're showing your child, the more that we're kind of allowing your child to feel in control and lower that anxiety, it actually will positively impact you as well as a parent.
It's interesting that you say that. What happens when we're really anxious or nervous? We get a very flat affect. And what we see when families first come here or they show up to Communicamp day one, I always say day one is tough. It's like you could hear a pin drop and, 100 people could be be sitting in the audience, but you hear a pin drop because parents are coming in very nervous. They're like, we've traveled far to get here. And you see that flat affect that projects onto their child.
Totally.
Their own fears, their worries, and we're going to get into fake it till you make it because that's one of my favorite statements.
Yeah.
But when parents are guided on how to parent their child, how to understand why their child is acting a certain way or what their needs are in a certain situation, it helps them feel better. Their anxiety is lowered. They feel confident in the process. And we see that over the course of Communicamp for 3 days. You literally see these families just almost like they come in really nervous and tight and kind of sitting up upright. Many of them, not all of them. But then you see that kind of loose noodle approach of they're relaxed, they're smiling, they're talking to the people next to them. We do a lot of things called Communicomfort in the program, but to help them feel comfortable. But you see that evolution in their face when they're leaving camp and they're feeling more positive each day. That projects onto their child.
Right. I will say too, I think that Communicamp's a great way to think about it because when parents come in a little bit more rigid or a little bit more hesitant in the beginning and they're quiet, they're looking for that connection with us as the providers. They're looking for us to let them build that trust and let them kind of allow themselves to trust the process. And it's almost like what we call in the psychology world of this parallel process of the therapist is kind of giving you more of that comfort so that you open up the trust with them. And that's the same thing that the parent will then do with their child. So I think it really does start with, as parents, if you think about even being with a provider, it takes time. And that's the same way that your kids might need some time. They're kind of testing the water sometimes with you. So allowing you to kind of change your affect, like you're saying, not being as flat affected will allow their child to feel, like they can let them in.
Yeah, no, for sure. And as we talk about this authoritative parenting, I want to say to our listeners, please be as positive as you can. So often when we talk with parents, and it does have an effect on parenting style too, where the different parenting styles talk to the parents talk to their children in a certain way. I find authoritarian, kind of my way or the highway, are the more disciplinarians. Obviously, they tend to be the one that's a very you should, you need to affect. And it really does cause the child to feel smaller and not as important and that they're not successful. And that projects to higher anxiety and that kind of fearful look too. And the permissive parent, maybe whatever. And I think what I'm trying to say is that I want our parents to be positive and upbeat. And I want them to, and we do this at camp too, where we say, please say 3 positive things to your child in a day. And I'm bringing that up because we're so fixated on treatment. I want my child to be talk. But forgetting who that child is and all that they're trying to do. And as you work and navigate through this process, you want to support your child in a positive way with what you say to them, not just how you look at them, not just but your affect, your, smile, but say 3 positive things to them in a day. Watch how they start to open up to you and not feel so judged.
Definitely.
Any thoughts on that?
No, I mean, I definitely think that a lot of times lack of communication is one of the biggest things that we find just in general when working with individuals. So I think, when thinking about helping your child or just honestly developing even a healthier relationship with your child, having that communication, allowing you to, just kind of empathize with your child and allow them to understand that you're next to them. You're not talking to them. You're talking with them. You're wanting to understand where they're coming from.
So we're basically going down how to become a more authoritative parenting. And let's just start with that empathy piece, because that's exactly right. Really letting them know, wow, I'm really proud of you for trying. Instead of, why didn't you do it this way? You need to do it that way. You need to say hi to your teacher. You need to do this. Every time you say you need to and you should, you're really squashing your child. There are ways to say you need to and you should without squashing them.
Yeah.
So can you give some examples of how to talk to a child where are, let's talk about greetings. Like that's a big pet peeve for parents. They think others think their child is rude. And many of our kids, as we know, may not be at stage 3 on the social communication bridge.
Right.
Maybe some of them are even shut down. They're not even able to be nonverbal or wave. But how could you accept your child and help them participate in a positive way and praise them, even though they may not even be speaking in that situation?
Yeah. Well, I know we mentioned the word empathy. Like, I think when I think of that, I think of understanding. And so I know even for me, when I'm talking to parents, a lot of times I'll explain even my fears. Or let's say, we're talking about greetings, for example, like I might say, I know when I'm going into a situation, like let's say a big family gathering, and I haven't seen these people, like we were just at a wedding, right? If I haven't seen these people in a while, or I'm meeting new people, I know I can feel really scared. And I know for me, that could take me some time to warm up and to get comfortable. And so it's totally okay if in the beginning, we're not as comfortable saying hi, but I'm wondering, because I know we're working on a lot of these things, how would it feel, as we're leaving, if I asked you a choice question like, wait a minute, we're about to leave, and I know Uncle Bobby wants to say bye to us. Do we say hi or do we say bye? And again, depending on where they are on their social communication bridge, either that child can bridge up to saying bye to Uncle Bobby. Maybe, the parent can turn and say, well, tell me, do you want to say hi or bye? And a parent could be a verbal intermediary, which is our stage 2. Or maybe a child waves by if they're feeling very overwhelmed. And that's not them regressing. It's just we're in a very new environment and we're not as comfortable. And so a parent should still praise that. Just because they might have not used their words, they're still in a new environment where they're practicing something really, really challenging.
So for young kids, that's great. And one of the things depending on the child, they may have external motivators, right? They may see the bridge and where they're at on the bridge, and they get more points, and maybe we'll do a copy back. So our knowledge of what their baseline is in that state, in that setting, is going to be helpful. So preparing in advance, for example, hey, we're going to the wedding. We're going to see people we don't know. Like you said, I love it, Jenna. Like I get nervous going there, instead of you shouldn't be nervous, or you need to do that, or not preparing at all, having that lackadaisical approach. That's not great either. But kind of going in a positive, upbeat manner, like, hey, we're going to see a lot of people. Let's see how many people we can like kind of hands up wave to. Now, when you're dealing with teens, it's different because we can't do the like, tell me, they don't tend to do it. But for some teens, just a hand up, I tell them, is like, that's a high.
Right.
And we talk about what it feels like between 0 and 5. So we respect their feelings, like thinking about going to the wedding. So one of the things I would do with a teen in session is be like, anything coming up, and we'll talk about it. And they might go, yeah, we're going to my cousin's wedding this weekend. Okay, let's talk about that. What are some social communication opportunities? So we might go through an action plan, kind of prepare them. So that structure, that consistency, and parents kind of mirroring that to them, like getting out that action plan and talking to them about it in a very kind of positive way, but understanding that they can bridge down. And some, it's copy back. Someone says hi, they say hi.
Right.
And maybe that consciousness of just hi, and you practice that just for things like greeting, just talking to them in that way. And where younger children are playing the games, the hi-bye games, the teens are doing their goals of what can they do, and kind of troubleshooting in the beginning of what could happen. Kind of being on the lookout. It's, upbeat and positive, like, let's look out and see how many that we know. Let's see if we see Uncle Bob or Aunt Sally, and kind of know what they're going to ask. So just the way we're talking to each other is how you want to talk to your child.
Exactly.
In other words, like very kind of like matter of fact, upbeat. Let's play our games. Let's do our goals, depending on the age of the child, and getting ready for it. And I think that's the way, rather than you need to talk without any preparation, without any visual supports, without your knowledge of how to bring them into that social communication opportunity.
Yeah.
And so your way of doing that is really important. So we talked about empathy towards your child, and showing confidence. We talked about fake it till you make it. That's a form of authoritative parenting, where you're showing confidence in a positive way and letting your child know you're proud of them for trying. And I'm really proud of you for doing these games or doing these goals. I'm really, I know this is hard.
Yeah.
And it looked like it felt like maybe a 2 this time out of 3, or a 2 out of 5. What are your thoughts on that? Like, just very open.
I definitely think that that's very important. I know we talk a lot about direct language, right? So instead of saying like, oh, can you pass that? Or can you do that? Being very direct, because otherwise, like you're mentioning, that actually insinuates doubt in the child. And that might make the child feel like, well, does my parent trust me? Or does my parent feel like I can't do it? What if I don't do it? How are they going to talk to me? So just allowing your child, still being direct and kind of guiding them, but also providing the empathy at the end of the day as well to make sure that they're feeling comfortable.
So avoiding can you? So can you do this? Can you do that? Do you think you may be able to? It's, hey, let's do this.
Yeah. Or let's do this together. Or if a child, if you have a teen, maybe, hey, I know that we're working on this and you're really motivated to work on this. I will be here if you need me. What do you need from me in this moment, right? Like some teens might want to work on goals by themselves, but a parent should still have that conversation potentially about what that might look like for them.
And I know that some of our listeners, our parent listeners here, are going to say, my child's not motivated for anything. And my child won't do any of these goals. And that's where we talk about silent goals.
Right.
That's the way you talk to your child. It's how you set up the situation. It's how you bring them into the social communication opportunity, the selective mutism triangle. And we can put that as a resource in this.
No, definitely. And, we're saying a lot of these things very generally, but of course, everything's very individualized. So yeah, there are some kids that if they have a really, really, really high expectation, and this could be a whole other podcast, but that is where silent goals are really, really helpful, because that's where parents and teachers can kind of like facilitate the world around them without them kind of having that high expectation. Right.
So in other words, I'm not going to be like, hey, let's we do hand over, take over for social engagement, but we're not like, well, just point. We don't suggest pointing. We bring them into the social communication opportunity by the way we question, when we question, how we question,
exactly,
where we question, the different goals we do, the games, whatever it is we're doing. There's a million things. As I say, I feel like I have a million terabytes or gigabytes of information.
You definitely do.
But it's how you put it together, and it's how you talk to your child. So I think mirroring back your child's emotions is another aspect I'd like to talk about, where you validate them. So some examples of that are like, hey, I noticed when we went to the wedding, it took you a little bit longer. That's okay. It took me a little longer too. And maybe and kind of validating, that could have been a little scary. It could have been a little hard, especially when, Uncle Sam came right up to you and started telling you right away, like, okay, are you going to talk to me today? That's pretty frustrating. And kind of mirroring kind of how your child felt. Any examples that you can think about in terms of listening and validating and mirroring back your child's feelings, any situation?
I think that's a great example. I'm also thinking back to I know it's mid-September, so just back to school. Maybe a child is feeling very hesitant or very nervous about going back to school, and kind of noticing maybe some of their body language and just mirroring to them kind of that positive kind of affect of, it's okay to feel a little bit nervous. We're in the beginning of the school year, but, each day we go in, I'm noticing that we're feeling a little bit more comfortable. Like, let's keep trying, or you're doing an amazing job. Like, what are things that might make you feel more comfortable? Maybe we'll go to school 15 minutes early just to kind of sit in the parking lot and kind of validate that it's totally normal to feel a little bit nervous in the beginning of a school year.
Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode. So one of the things I'd want our listeners to think about is, what are some additional ways or situations that may be coming up that you might anticipate some anxiety where you could validate them? Or what were some situations in the last few weeks where you're like, oh, I could have been a little bit more supportive of their feelings rather than either kind of, hey, listen, pull your bootstraps up and just, you can do it, go do it, without realizing they could be a little scared. I learned this really early on, many years ago. You were just like so big, but where I had it was an 8-year-old boy, and I'll never forget we were working on the interview process, questions and answers, where he would interview people, and he loved it. He was like this, took his clipboard wherever he went. And we're sitting in session, and the parent said, "Oh, this is really easy for Oscar. He can absolutely do this. This isn't a problem. I don't know why he needs to do interviews." And Oscar just had this look of fear on his face. And I said, well, wait, the question answer process helps, because when they're doing, and I explained the value of the interview process and how that kind of gets their motor going, and based on the stage that they're at. And Oscar rated it as a 5 out of 5. And actually, he was one that would divide things up. And so instead of 0 to 1, it was 0 to a quarter to a half to 3/4. And he actually, with some of the questions, was like 100. And so Mom was like almost frustrated with Oscar that it was hard for him. And I said, look, we need to trust Oscar here. Let's kind of bridge down a little, get him started. Maybe he finishes a sentence with you in the beginning. And Oscar rated that as a 2. And so that's how we started. And he did so well, so quickly, and was rating and grading his feelings, and realized he could do it, that he started reading the questions to Uncle Bill and Aunt Sally at the next family function that he chose that he wanted to do this with. That control of who he was going to do it with, the actual questions that he knew in advance, he felt in control. But by just trusting this process and validating his feelings rather than fighting them, he made more progress than he thought he'd ever make.
Yeah.
So the reason I'm bringing that up is it is so important to trust your child, but also to guide them. Sometimes you might think this is easy, but it may not be easy. And I'd rather you bridge down, and you're going to make more progress, than to push.
Yeah. Well, you also mentioned a perfect example of a feelings chart, which I think we use a lot in our treatment. And I would say that that's actually a great authoritative parenting approach, to be honest, because a lot of times when we don't necessarily utilize a feelings chart, a lot of times our kids can kind of feel out of control, because it is really hard sometimes to put our thoughts into feelings, right? It's to explain, like when we're going home from school, how did you feel today? How was school today? And your child's sitting there like blankly, right? Like, I don't know. And of course there could be some speech and language trouble and things like that. We don't know the whys of SM for them, but a lot of times it's because our kids might have trouble describing how they're feeling. And so a lot of times we'll incorporate that. Like we might put, let's say, a feelings chart on the refrigerator. We might put it somewhere, and that could just be the initial dialogue that you have with your child, throughout the day of, I'm noticing that, you're looking a little bit nervous right now. Like, let's pull up the feelings chart. Like, how are you feeling right now? And so it just allows them to kind of connect with you. And then just that initial shift of talking about a feelings chart will allow your child to start to empathize more.
And it's interesting, because I have found when a parent has an authoritative parenting style, because it's such a respectful style, it's such a respect towards their child, that they're way more open. So what I find is the more authoritarian, my way or the highway, the more permissive a parent is, the more uninvolved, the less open a child is and aware of their feelings.
Right.
And so it is difficult for many of our kids to explain, and many times they have no idea. So having means to express their feelings, we use that numerical value feelings chart, because it helps us plan our goals and helps the child realize like what it felt like before I did this game or goal and what it feels like if I had to do it again. Is a very cognitive behavioral approach, a CBT. But any way to help them just get used to expressing their feelings through feelings journals, music, art. This helps them with their feelings and validating their feelings. So I think we've talked a lot about this, and I'm hoping our listeners are gaining some inner, gaining understanding from this.
And you mentioned modeling, and I think the feelings chart, and again, feelings chart could actually be also its own podcast, because I think a lot of people, once they really understand what it is, they recognize like the importance of it. But I do think that modeling and saying maybe initially like, oh, I was feeling like a 4 out of 5 on my feelings chart when we first walked in. But then when I left, I know that I started feeling more like a 2 out of 5. And then asking the child. I love
that you're bringing up, this could be another podcast, because we're always looking for topics, and we could do a whole episode on the feelings chart.
Yeah, I say that too, because I think you and I are very known to go on tangents, and I want to stick with the parenting. So I'm like, oh wait, this is a great idea, but let's kind of keep within the kind of frame.
I wonder where you got that from, kind of going off on tangents.
Well, you.
Okay. I want to get into structure, consistency, routine, and predictability. There are like 4 words I use a lot in every aspect. I mean, all the charting we do that we like the kids to do, the parents to do, is not meant to overwhelm them. It's meant to guide them. It's accountable goals. One of the things I get a lot from parents is, wow, no one ever actually gave me accountable goals. They might say, go into a store and ask for something, but it wasn't in a way that was very structured for them. So it was hit or miss. They either did it or didn't. And teaching them the bridge and knowing how to bridge down that structure of the bridge gives control. It's all about transferring control. But being an authoritative parent is about giving these children that structure, their daily structure, knowing what, when, and where. The consistency in their routines is anxiety lowering, knowing what, when, and where. Just the routines in general. Let's discuss ways that it can be more not just mom and dad, because we want to teach and kind of shape independence. And so we don't want a child completely dependent on a parent to tell them what, when, and where all the time. So one of the things that I want to talk about are the kind of schedules that we recommend. And of course, based on a why, some kids need schedules more than others, the whys of SM. But let's talk about schedules. Do you want to get into that? Like even daily, weekly, monthly, and why that's important?
Well, I think when we think about like a schedule, and that could look like a lot of different things. It could be an individual child schedule. We also recommend a lot of times like a family schedule. Like if you want to put a family calendar on the board so you can see even like the siblings activities or parents activities. So again, it's not just the focus of the child, if that's best for your child, but schedules are a way, again, to build that consistency, that structure, the predictability. And for a lot of our kids, if they don't know what to predict, that increases their anxiety. And so it allows them, if they know they have like a ballet class on Thursday and then a recital on Friday, well, then maybe on Wednesday night, that's when they can go to the store. They can get a few materials that they might need. Maybe they're having after the recital, they're having a little family gathering. So again, it allows them to also prep a lot of their goals for the week or their games for younger kids. And they have the ability through the visual of the schedule.
Yeah, like I think about going to the dentist or going to the doctor or going for an eye exam, whatever it might be, or just even needing to go and pick something up at the post office or drop something off. If that's on the schedule, it mentally prepares you for that rather than, oh my gosh, it's Saturday morning, get up, get dressed. Why am I getting up? Why am I getting dressed? If they're used to kind of hanging in their PJs and sitting and watching a morning TV show or on their device or whatever it is that the parent, that is more of a routine for that child, good, bad, or ugly. I don't know how long they're on devices. That, again, is a whole nother episode. But if the child knows I go to the dentist on Saturday morning, they have a means of mentally preparing for that.
Yeah.
The parents are preparing them. That's anxiety lowering.
Right.
It's understanding my child does not do well with quick, changes, that transitions are important for most, especially an anxious child. The transitional process is very, very important. And so the more that they can transition into something, the less anxious, the more in control they feel. So again, everything about being a parent, if you are an authoritarian parent, come on, get up. It's Saturday morning. We have a dentist appointment in an hour. What are you doing in bed? Get up. I didn't know. It's a whole fight.
Yeah.
The permissive parent is like, whatever. I don't want to go. I don't want to go today. I'm not ready. And having a tantrum, and the parent goes and cancels the appointment.
Right.
And the uninvolved parents didn't even realize there was an appointment until 2 seconds before or whatever. Again, I'm extreming these parenting styles.
Yeah. And I think, Well, and I also think just with the schedules, knowing your child and knowing, maybe how detailed you want to make the schedule. So for example, we always talk about like with dentist appointments or doctor's appointments, whatever that might be, that could create higher expectation or more fear, right? Sometimes those appointments are scary. And so your child might not want to see that the month before. So maybe a few days before is the time to prep them compared to maybe knowing a birthday party a month before. So knowing kind of like what's the most ideal timeline. Some of your kids also might need like more of a schedule even during an event. So for example, if you're going to a dentist appointment, sometimes I've even not only made the daily schedule, like, okay, you have your dentist appointment at 1, but maybe you even bring a little schedule with you at the dentist appointment, and they can check off like each thing. So we get there and we're going to check in. Okay, let's check that off. Then we're going to go to the back and sit in the chair. Okay, we're going to check that off. Then we're going to first meet with like, the person who's going to first clean our teeth. Then we're going to meet with the dentist. Then we're going to get our prize, check it off. So it's like even having a detailed schedule of even an event could be a way to kind
of. And that's kind of distracting too. And it kind of takes our mind off of it.
Right.
And being on the lookout. Let's see if we have Mrs., the dental hygienist with the blonde hair or the dark hair, and they're on the lookout for what to distract them. But these are just ways to kind of get them through to lower their anxiety. Mm-hmm. But I really do like the idea of that schedule, knowing when they're having get-togethers, knowing when they have their after-school activities, knowing when they have a birthday party, just helping them. And the daily of getting up and the routine of I get up, I brush my teeth, I get dressed, I go down for breakfast, and then maybe beating the clock to get there a certain time. Mm-hmm. This is a way to kind of work and look, listen, and learn for what your child needs. Some children don't need this as much.
Right.
So by no means are we saying to our listeners, every child needs to have this rigid schedule, but the treatment provider you're working with should be guiding you. And that's the beauty of treatment and individualized treatment is no two children are exactly the same.
Exactly.
And it's all about tweaking and putting together an individual recipe. And some may need more of this than others, and some just kind of on their own. Like I have plenty of teens that come in with their schedules on their phone and they have a calendar app, and they're the ones doing it and reminding their parent where they need to go and when they need to go. Because they have figured out if I have a calendar and I know my schedule, I feel better. So it's very important as children age that they take that kind of individualized step. And even with the big calendars like on the kitchen or in the mudroom wall, that I encourage the child themselves to be putting things on those schedules so that they're independent doing mm-hmm. it. They're putting the tally on there mm-hmm. or their daily schedule. They're doing it, not mom. I can't tell you how many times that if that is not said to a parent, 9 out of 10 times mm-hmm. the parent does it and not the child.
Right. And also think about even with authoritative, right? The mix between the warmth and the control. So you're giving them the daily schedule. That's the control piece, but you're also explaining to them why we're doing it. So, yep. We're putting this family calendar up and I'm going to have us put all of our activities. And I'm doing that because I want to make sure that when we're going throughout our week, this is going to be making us feel more comfortable. I know for me, it definitely makes me feel more comfortable when I feel like I have control.
Right. So you're not putting it all on the child. This is for you.
Right.
Right? This is for us to feel. So that's almost like a silent goal in a way, right? Mm-hmm. As I call, and for our listeners, silent goals are when we set the world up, as you said. Active goals are when they're doing it.
Right.
So they're either doing active games where they're checking it off, drawing, keeping track, mm-hmm. Knowing the goals, the games. But silent goals are when we set the world up. We as parents know our child does better with this kind of structured process mm-hmm. and even the daily calendars, dealing with different difficult behaviors mm-hmm. and kind of charting to reward positives, minimize negatives. That's a huge thing for me. Instead of emphasizing the things that they're doing wrong or things that aren't right, we're bringing up how to make it positive. So we flip it. I call it flipping.
Flip it to a positive.
Flip it to a positive. And flip it to a positive means you take a difficult, negative situation and you change it. So some examples are sharing. Young, like children in general, have a difficult time sometimes with sharing with siblings or friends. So what we do is we add that to our positive reinforcement chart, and we get points or tallies for younger children, stickers for sharing. So every time they share, they get a sticker or a tally, whatever it might be. Of course, the older they are, the positive reinforcement will change based on what they need to work on. But that's a common one. The positive reinforcement, kind of flipping it to a positive. Can you think of some others? I mean, we can relate it to discipline. It's all about discipline. And again, we have very sensitive kids, very sensory sensitive children where emotional dysregulation is kind of characteristics. Louder, larger, lots of people environments. Changes and transitions aren't great sometimes for families, especially the busier they are. The more sensory that, overloaded, they feel dysregulated. Behavioral ramifications are part of this. Right. So one way we help with that is the kind of charting and behavioral positive reinforcement will help them begin to regulate themselves.
I actually had I had a family that I worked with that, the child had a lot of disruptive behaviors, and it was because, again, the child felt very out of control. And one example that I gave the family, so not only the child, but I gave even the parents to make this goal, because again, they modeled it for their child, was to use a word every time they noticed that they were going from we use kind of like a 0 to 10 scale, 10 being like the most out of control and 0 being the most, controlled. And a 10 was like when they were at their max, like they were very disruptive. So what I taught the family was to use a word. I think they used, I forget what word they used, but they used this word every single time the child or even the parent maybe felt like they were at their max. Like, let's say the word was max or something like that. And so the child would get a positive reinforcement every time, instead of maybe punching the wall, or every time they would like storm upstairs, they would just look at their parent and be like, max. And that would allow their parent to know, okay, my child just needs to take like a deep breath. Like, that's okay. And like, they're not getting mad at their child, because again, like, sometimes we all have some behavioral things that we have to manage, but the child was learning that even when I was reaching my max, and then I can kind of start to use some of those coping skills to like take a deep breath. And the parents would actually use max when they were starting to feel overwhelmed, to kind of show their child, like, this happens to me even sometimes. So even creating almost like a word with your family, or having a specific family meeting to kind of discuss how we all will navigate it together is a great method for helping a family kind of navigate that as well.
Yeah, and that's authoritative. You're not, shutting them down. You're not dismissing it. You're not ignoring it. You're being very respectful to your child. And look, you go from 0 to 60 pretty quick. Mm-hmm. And here's some ways we can help in this situation. What word would you like to use? Here's some suggestions, or pick your own. And you're going to laugh, but when we talk about like adding people to the club to verbalize when they're adding them through the ritual sound approach, the RSA, I had a little boy that loved the word poop. So he called it his poop club. I wasn't going to fight him on it. He loved it, and he called it, they're added to my poop club. And just that funny word was anxiety lowering for him. And that's what we used. And so that worked. So assuming the word is like appropriate to use, I would be very accepting of whatever word it is that they use to represent either a feeling or how to navigate. And that gives them the control. He decided that word. I didn't decide it.
Right.
So I think that's, how do you deal with discipline? Let's talk about dealing with discipline consequences from an authoritative parenting style. So a child did something not appropriate. Mm-hmm. They did hit their sibling. They lied to you about something. They disrespected somebody else. They didn't follow through on a route. How do you deal with that?
Mm-hmm. So I think, again, when we think about those ingredients, like the warmth and control, still, let's say, giving your child like a timeout, or still saying, okay, I think it's time to go to your room. Let's take a deep breath. Like, let's say they just hit their sibling, but then allowing them to kind of calm down and go into the room, maybe have a conversation with them about what happened, like what was going on with you. This is why we're taking a break in your room, because that still was not appropriate behavior. We still need to understand that that's not okay. But I also want to talk with you about what's kind of going on. And so you're talking with them. You're still allowing your child to kind of have that space where they can be open with you and you're listening, but you're also showing them at the same time, like, that wasn't okay. We have to learn that that's not a behavior that we should be doing, but I want to hear you out. I want to hear kind of what's going on at the same time.
Yeah, if a child is able to handle that, little kids can't.
Depending on the age of the child.
Because we have so many sensory sensitive kids and emotional dysregulation, what I would say to parents is journal these difficult behaviors. When are they occurring? What was right before? Were they hungry? Were they tired? Were they overwhelmed, underwhelmed? Was it a really loud, overwhelming environment? Were they bored? Did they just get home from school and they acted out because we were expecting them to do something else and they needed downtime? Like, parents can learn so much, look, listen, and learn from journaling some of these challenges, like difficult behaviors, and then taking those difficult behaviors and, as a parent, learning how to help them. So if they come home from school and they like to vegetate, like I have 4 children, all 4 liked something different after school. Your sister loved to kind of hang out and just look at a TV set and relax. Whereas maybe you or your brother, one of your brothers, would go out in the backyard and run around. Like, everybody's different. And so respecting that, giving that time to an extent, And then kind of coming back to what they need to do. So maybe homework isn't right when you get home from school. Maybe it's after dinner for one child. You start to figure out what's best, but journal that. What were the triggers to cause some of these challenging behaviors? And then develop your positive reinforcement charting of kind of flipping it to a positive and being like on board. So if you know your child is hungry after school because they had difficulty eating in the classroom, then maybe have a snack in the car going home. I mean, I remember doing that for my kids. We would have a bag of snack because you run around the days long. And just by having that snack, regulated your blood sugars, you just were more calm rather than not eating. And then I'm trying to figure out, why is this child acting this way? They were hungry. Let's just give them a snack or suggest snack time in our routine. And maybe we have snack time on our chart. So what I'm trying to convey to our listeners is it's not just one thing.
Right.
It's not just one thing, do this and this is going to happen. And again, we're not even like, here we are talking about treating selective mutism. That's the expertise, right? We're not even talking about talking with anything we're talking about today. But this is part of the whole person approach. This is part of knowing what your child needs, how to support them in a respectful way, how to parent them so that it lowers their anxiety, they feel in control, and they can journey through this treatment process, which the more authoritative you are, the more you treat the whole person, the quicker treatment is.
Yeah. And I think the reason why we're also not even talking about talking is because this type of parenting can benefit with any type of child or any type of, disorder that someone might have. So, I mean, this could be a child that has, is on the spectrum or has ADHD or, might just have some speech and language. They might not even have SM. This could be a sibling of the child with SM, right? So I think just knowing that authoritative parenting is really, really beneficial for honestly anyone, because I think it's just about connecting with your child, understanding, but also giving them that structure at the same time.
Yeah, no, I think we've talked about a lot. I want to end with the importance of choices with boundaries. Giving our children as many choices as possible to either doing their exposures, their social communication goals, their schedules, helping them write the schedule with you, but you're setting up the boundaries. And some easy examples are routines in the evening, like we talk about bedtime. And again, this is for younger children typically, but even for teens, like maybe they don't do well staying up till 2 a.m, playing on their device and they're overstimulated. So you have to set the boundaries, right? When devices end, so many hours a day that they're doing it. But for younger children, maybe bedtime's 9 o'clock, but they're kind of hanging out with you, reading a story, or just like hanging out, talking. I think it's important that parents give them that time in the evening to cuddle and talk. And they need to shower or take a bath, but they can't miss out on some of these things. But if the child is running around and it's 8:30 and you've told them by like 7:30 that, hey, we need to go up, we need to clean the playroom up or organize your desk, and then you need to shower, and they know what their routine is and they're still messing around, they're going to miss out on something. So you're kind of giving them the choices of what's more important, me hanging with you or you just running around and just kind of like goofing off, because I can't do both because bedtime's 9 o'clock. So you're setting the kind of rules, but they have the choices. And so if they have like a tantrum because you promised you lay with me every night and we talk, yeah, but you made that decision. You made the decision tonight that you were going to finish, drawing in your drawing book, and that's great, but maybe tomorrow you'll get done sooner. So it's how you kind of set the boundaries. The same with alternative meals. That's a big one for me. Our sensitive kids may need alternative meals, right? But they can't have like a chocolate chip cookie for dinner. That's just not part of it. But we set it up with, hey, here are alternative meals. Pick one of them in advance. They do it. They help prepare it because they don't want lamb chops. That's okay. I may not like lamb chops either. But they can't have whatever they want or say during the meal, Mom, I don't want this anymore. Go get me a chocolate chip cookie. And the mom jumps up and does it. That's not good, because what you're doing is you're a pawn to your child. That creates out of control for them. You're now like the permissive parent. Like, you see what I mean? How it all feeds in. We hear choices a lot, that word choice, and we think choices. Do you want red or blue? Do you want an apple or a banana? Like in terms of social communication, because they hear the right answer second, which minimizes their need to think and process. I'm not talking about those types of choices. I'm talking about choices in what they're doing on a daily basis where you set the boundaries.
I know that we've been talking a lot about structure and predictability and like calendars and things like that. So if you have like, let's say a bedtime routine, like you were saying, giving the choice, let's say it's 8:45 to 9 o'clock is like the last activity you're doing before bed. Maybe there's a list of like choices. Like we could either finish your puzzle, you can either play on your tablet, you can, I can read you a bedtime story. And so you're still giving them that choice within that time frame. So that's another example.
Yeah, I think it's all about giving them control and transferring control. And we'll put some good resources in the podcast episode to help with authoritative parenting. Listen to me. We don't want to push authoritarian. It's authoritative parenting. So we'll definitely do that. And again, for our listeners, your treatment providers could be spending sessions going over this and helping with parenting. I can't tell you how many times over the years parents have shared with me that just by what they learned, how they learned it, how to parent their child is what made the biggest difference in treatment for their child. It wasn't just the exposures, which are critical, but it's how to implement the exposures, how to help that child on a daily basis get through life.
Yeah.
That whole person approach is just so critical. So thank you, listeners. Any last minute comments, Jenna?
No, I mean, I think I know that people have been asking about a second edition from our first podcast about the parenting. So I hope this was really helpful. And I definitely think, definitely talking to your provider about some of these things is really important, right? So like, even if you have weekly sessions for your child, maybe every fifth session is just spent with the parents where we can talk about some of these things with you. So we're always here to help navigate. But again, I hope that this was very helpful for you to gain some insight.
Yeah. And I think depending on, like, when I see a family, I can assess how much parenting needs to be done, how much parenting work. And some families come in where it's not the severity of their child's mutism that dictates the progress. Frankly, it's the whole picture. It's the whys, but it's also the parenting. I would say parenting is the number one factor in progression of communication in terms of being quicker or slower. And so anything we can do to help a family, we're going to do so that they can parent properly. So I thank you, listeners, for this opportunity to educate you, and look forward to the next podcast.
Thank you.
If you have questions on anything covered in this podcast episode, we want to answer them. Please head to selectivemutismcenter.org/ask-DRE. And we'll do our very best to answer them in upcoming podcast episodes, Smart Center newsletters, and on social media. Thank you.